But we begin 5 with a call for protection for the people protecting us. Good evening. I'm Courtney Gooseman. Thanks so much for joining us.
And I'm Frank Wiley. In 2020, the leading cause of death for law enforcement was not a suspect with a gun or a car crash. It was COVID-19. But in Ohio, the state's 25,000 law enforcement officers were not included in the first phases of vaccination.
And now there's a push to change that. News 5's Jordan Vandenberg. He begins our team coverage. He joins us live with an in-depth look at this effort.
The number of law enforcement officers that died in the line of duty in 2020 was nearly double that of 2019. And the law enforcement community says that fact alone should warrant them a place in the vaccine line. When you just want to make it home at the end of the shift, law enforcement already has enough to worry about.
Our members are still out there answering the calls.
And for nearly 12 months, there has been even more.
I mean, our guys and gals are out there, as you know, on the front lines. They're first responders for a reason. They probably come in contact with more people a day than any other group of people.
We know what they do on a daily basis. And frankly, the governor knows what they do.
When Governor DeWine's vaccine rollout plan included firefighters and paramedics in Phase 1A, law enforcement officers were notably left off the list. Brian Holb says it wasn't for a lack of lobbying.
We received a response from the Ohio Department of Health saying that they would pass it along to the leadership team. But that's really been the extent of the response that we've received from the Department of Health or from the governor's office.
Data shows the pandemic has made an already dangerous job even more so. The National Law Enforcement Officers Memorial Fund reports 264 officers died in the line of duty in 2020, the highest total in nearly 50 years. 145 of those deaths were confirmed cases of COVID-19, although none were in Ohio. However, the report also projects that total to grow significantly, quite literally, sending this graph off the charts.
I don't know what other proof those at the state level need to show that our members are coming into contact with this virus on a consistent basis.
We've been told, when the Super Bowl was coming up, don't have parties at your house where people are yelling because it spreads the virus more rapidly. But yet that's what we confront every day.
Gary Wolski, a retired officer in Garfield Heights and president of the Ohio FOP, also says the virus has run departments ragged because of positive cases and close contacts.
And what that does is it obviously detracts from what they can do on the street to protect the communities because they're so shorthanded. And then if you fill that in with overtime, the folks are getting tired.
All of Ohio's neighbors, including Michigan, Pennsylvania, Indiana, and Kentucky, have placed law enforcement in their Phase 1A or Phase 1B vaccination schedules. Wolski says law enforcement doesn't want to jump ahead in line. It merely wants to have a spot in it to begin with.
Now I see that the governor also wants to let the care workers at the nursing home facilities that refused the shot the first time to get back in line ahead of the cops again. If you didn't want it, why you give them a second chance?
We reached out to the governor's office and they gave us a statement that said that law enforcement community makes a compelling case, but unfortunately they're still dealing with shortages of the vaccine, and that the governor's plan prioritizes the protection of those who are most vulnerable, as well as getting students back in the classrooms earlier than later. Reporting live in Cleveland, Jordan Vandenberg, News 5.